A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937 to get more information and make an appointment. Board members get 10% off.
It's 9 o'clock. It's Saturday morning, but not just any Saturday morning. It's the 21st of January, which means it's Errol Barrow Day. And you are about to hear 50 bank holiday eye-opening minutes with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Center, who would like to reach out and wish all Barbadians Happy Errol Barrow Day today, as we celebrate the life and contribution of the father of independence. So good morning, Mr. Larry, and good morning to all of Larry's friends who are listening. It's a bank holiday, so you should be home relaxing, thinking about how great objectives can be achieved, including achievements like the Maria Holder Diabetes Center, with their mission to enhance diabetes education and promote self-management skills, empowering individuals like you who are listening, whether you are diabetic or pre-diabetic, to play a more active role in diabetes prevention whilst assisting in the search for cures. That is why they feature a range of services at the Diabetes Center, like podiatry to help you take care of your feet, diabetes specialists like Dr. Diane Braffett. If there's anything bothering you that's diabetes related, you can call and make an appointment with Dr. Braffett. There's also the Diabetic Eye Screening Program with Dr. Charles Spears, where you can call and make that appointment. 243-3937 is the number for appointments, and you can have your eyes checked for diabetic retinopathy. So make sure you make that appointment. And take note of the eye screening outreach program, which will be in the north at Eddie's Supermarket in Speightstown in the month of February. Dates to be announced soon, so keep listening to this program for more details. Also at the Diabetes Center, they have a vascular screening program where if you have bad circulation,
my foot swell up and it's hurt me real bad,
you can have your feet and extremities screened for any vascular irregularities. And so on this morning's show, we are going to focus on vascular, because there are a lot of people out there that have questions about this vascular screening. How do I know if I should get a vascular screening? Can vascular issues be passed down through your family?
Why so much people in Barbados is getting a foot cut off though?
All these questions and more will be answered right now by a vascular surgeon who will now introduce herself.
My name is Nina Yap. I'm a recently appointed consultant vascular and endovascular surgeon. I work at the Queen Elizabeth Hospital as well as in my office, and I'm recently been appointed to really work on circulation issues affecting the public of Barbados that present to us at the hospital and elsewhere as well.
Dr. Yap, why is Barbados called the amputation capital of the world?
Barbados being coined the amputation capital of the world is a really difficult label for us to all of us have to hear and live with every day. I believe that came about because of some studies that were done a few years ago with the number of amputations. And when I say that, I mean amputations that are happening below the knee and above the knee. And what the public was really seeing was a number without really any explanation or delving into the reasons why it might be. There are so many reasons that someone ends up at an amputation, and unfortunately, a lot of what the public sees, and our patients tell us this every day, is that I might not really feel like the drive towards saving a leg or a foot is there. But I am, here on the backs of many surgeons and persons that I've worked with for over a decade to say that being coined the amputation capital of the world it was slightly a mislabel, and it wasn't well deserved. Admittedly, there are a number of amputations here done, but to really understand the disease of which is affecting our people, everyone will then probably hopefully appreciate a little bit more what kind of beast we're against, and that is the amount of blockages that we see below the knee. Below the knee are the smallest arteries, or some of the smallest arteries in the body, and when you get down to the toes, you're talking about arteries that are less than 2 millimeters, or even smaller. So when those have blockages, there's hardly really any reversing of that. However, with the advent of medication to combat diabetes and high blood pressure and cholesterol, taking the right sort of portion of medication can help slow the progress of this disease. What I tell patients is that it can't reverse it, or it's unlikely to reverse what's already there, but it can help the progression or help getting it worse, as well as what we do here now, which is endovascular surgery or revascularization. It's really a big word in that we try to do techniques and surgeries or procedures to try to open up blockages and try to tunnel a hole through the arteries for blood flow to go down. Being coined the amputation capital of the world, I guess to answer your question directly, is a label that I refute and try to get patients ready to understand more than just coming with a label, but try to steer them towards how we're trying to change really a whole movement for peripheral arterial disease. But it is difficult, and I understand that sort of flag is in people's mind always, and it's something that we deal with every day at the hospital for sure.
Is PAD hereditary? Can it be passed down through your family?
So peripheral arterial disease does have a hereditary component. So again, with the Afro-Caribbean or black population in the ancestry line, all the way from where ancestors would have come across from Africa, there's something in that hereditary line that is still not untapped or fully understood. So there is a hereditary component. I'll sometimes speak to a patient who is not a smoker, has been a fairly good, active patient their whole life, has tried to eat well, and they'll have a peripheral arterial problem, or they'll have an ulcer on the toe. And when I hear how they've lived, they sort of feel disappointed in themselves. And what I tell them is that you could have lived the best life that you could have, and you can't change your genetics. There are three things that you can't change, or maybe arguably so. You can't change your age, you can't change your gender, medically speaking, let's say for the purpose of this talk. And number three, you can't change your genetics. You can't change the line of ancestors that you come from. And so there is definitely a hereditary component, which is what we see a lot in our population. Yes, you could argue maybe not the healthiest diet in a lot of Barbadians, but I can tell you certainly that there is a strong hereditary component in poor circulation.
So you mean that you could be eating healthy, you could be exercising, and still end up with PAD?
I'd be honest, yes, which might be disheartening to hear, and I'm not here to disappoint anyone, but patients who live a really healthy life, or say quote-unquote healthy life, still end up with many disorders that, they didn't think that they would get. So let's say a tumor or some other growth in the body, and peripheral arterial disease is no exception. And so from the time you're 10 years old, cholesterol starts to deposit in your arteries, and it progresses as you get older. And that's part of the genetics of the body and part of the natural aging of the body as well. But with the right, I can tell you that someone that has the genetics maybe against them, living that healthier lifestyle and not smoking and keeping the cholesterol under control, has a much better chance of having a good outcome in the long run than someone who has the same genetics and smoking very heavily. Cholesterol is out through the roof. The diabetes is fully out of control. So you can't change your genetics, and that is what it is, but you can hopefully help the course of your peripheral arterial disease, that if and when comes, be that much more manageable and have a better outcome if you can control what you can control.
As we continue our vascular focus on today's Maria Holder Diabetes Radio Show, we now go to our song of the day. And for this, our Barrow Bank holiday, here's a song that's guaranteed to make you lift your leg up and improve your circulation. This is the band Spice from 1992, with this selection entitled exactly that, Lift Your Leg Up, compliments the Maria Holder Diabetes Center.
Sunshine or rain, lift your leg up, 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 lift your leg and wine, wine,
Contact the Barbados Diabetic Eye Screening Program today at 243-EYES, 243-3937 to find out how you get your simple digital eye screening done. The Barbados Diabetic Eye Screening Program.
Carnival are coming, we coming to bump and wine. Carnival we coming, we bringing the conga line. So why not carnival for see? I know you're up and ready. This party on my party, lift your leg up, you will see. Super blue, crazy taboo, we come to play mass with you. This dance crazy's everywhere. Lift your leg up in the air, lift your leg up, lift your leg up, lift your leg up. Lift your leg up, lift your leg up, lift your leg up. Lift your leg and wine, wine, wine. If you want to party, lift your leg and wine, wine, wine. If you wild and want see, lift your leg up, lift your leg up, lift your leg up. Lift your leg up, lift your leg up, lift your leg up.
Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937.
Lift your leg on 2, lift your leg on 3, lift your leg on 4. Aye, mama, I see you doing it. Now we're gonna try that one again. On with it. Lift your leg on 1, lift your leg on 2, lift your leg on 3, lift your leg on 4.
243-3937.
Wine your waist, wine. Lift your leg and wine, 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 wine, wine. If you want to party, lift your leg and wine, wine, wine. If you wild and want see, lift your leg up, 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 lift your leg up.
Once you have reached 50, you need to go and get that check done. It's peripheral artery disease. It's a simple test. It's called an ABI test. What they're looking for is to see the blood flow in your lower extremities. And I can't stress enough the importance of getting this test done. I'm glad to know that the Maria Holder Foundation is offering this. Individuals need to go and get that test done. It's a simple test. It's all external. Again, it's like taking your blood pressure on your lower extremities.
If you are looking for an institution that's dedicated exclusively to the management of diabetes in Barbados, that offers a range of services that caters to both diabetics and pre-diabetics, the Maria Holder Diabetes Center, located in Warren St. Michael, is the answer for you. Whether it's diabetic eye screening, podiatry, or vascular screening, you will receive a level of service and treatment that exceeds any you might receive regionally or internationally. So if you are listening to your radio right now and need to make an appointment or need more information on any diabetic issue you might have, make that call now at 417-0305 or 243-3937. The last 15 eye-opening minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Center. Until next time, remember, your health is your wealth.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done for just $90. Board members get 10% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.
Coming up next week on the Maria Holder Diabetes Radio Show.
If you have a strong heartbeat down by your toes on both legs, it is unlikely that you have major circulation problems.
Make sure and tune in.